So now we're going to focus on the female reproductive system, starting with the vagina. So the vagina is a tubular organ that's located between the rectum, urethra, and bladder. There are two major functions of the vagina. The first is it serves as a receptacle for semen. So its job is to stimulate the penis during sex and to serve as a receptacle for semen. The second is it is the lower part of the birth canal. The hymen is a tissue that covers most of the opening of the vagina. This is ruptured during the first intercourse. The fornix are corners inside of the vagina that can store sperm for up to a week. So a woman can get inseminated and then 6 days later end up getting pregnant from that semen. The vulva. Vulva are the folds of tissue that surround the opening and protect the opening of the vagina. So this is a picture of the front part of the female reproductive system, and here you can see these corners here. That's the fornix of the vagina, and that can store sperm, like I said, for up to a week. The cervix. So this is a cross-section of the female reproductive system. Here is the rectum. You have the large intestine there, the anus. This is the vagina. The vagina leads up to the cervix, and the cervix is the opening to the uterus. Then you have the uterus here. You have the fallopian tubes, also called uterine tubes, and that's the site of fertilization, and that transports the egg to the uterus. And then the ovaries, you can see there's one right here. You have two ovaries. The ovaries contain the eggs. The uterus is the organ in which the baby develops. And the uterus has three main layers. The endometrium is the innermost layer. And this layer is the layer that is sloughed off during menses. The myometrium is the muscular layer, and that's the layer that contracts during childbirth. And the perimetrium is the outermost layer. It surrounds the uterus, and it makes up the membrane of the parietal peritoneum. So it is consistent with that outer membrane that coats the abdominal cavity wall. The uterus is pear-shaped, and it ends in the cervix. The broad ligament suspends the uterus medially. Here's a picture of the broad ligament. You can see it's depicted on one side now, but it's also on the other side. And the round ligament suspends the uterus to the anterior abdominal wall. So this should also be folded. I'm just going to take care of that real quick. And here you can see that round ligament. During pregnancy, if you've ever heard of pregnant women complain of ligament pain, there we go. So I'm just going to repeat what I said just because I had that little error that come up. So like I was talking about, while the woman is pregnant, the baby is going to start growing, and that growth is going to extend the uterus up into the abdomen. And as that uterus is extending up, it's going to pull on this round ligament. And that's very painful to first-time mothers especially. Once they've had a baby before, usually the second time around it's not as painful. But that pain can be alarming. Some women think that they're losing the baby, or they feel that they're going into labor, premature labor, stuff like that. So it can cause a lot of anxiety during especially the first pregnancy. But that's just round ligament pain. It's normal, and it's due to the stretching of that ligament as the baby is growing into the uterus. The uterine tubes or fallopian tubes, they're attached to the uterus, and the suspensory ligament suspends those tubes. Here you can see the suspensory ligament suspending the uterine tube or fallopian tube. The function of the uterine tube: transport channels for ova, and they serve as the site of fertilization. The ovaries are held to the sides of the uterus by the ovarian ligament. Functions of the ovaries are oogenesis, or egg production, and the secretion of estrogens and progesterone. Here you can see those ovarian ligaments that are holding the ovaries to the side of the uterus.